My name is Sheryl Elkin. I'm the Chief Scientific Officer of N of 1, now a QIAGEN company. I'm in charge of the science team. So I was the first scientist at N of 1, so I helped build out the database, design the reports. I've worked with all of the scientists, and we now have a team of PhDs that help write all of the reports and populate our database. N of 1 was founded to help connect cancer patients and their physicians to targeted therapies. So N of 1 started out with our group working directly with patients and their physicians to determine what molecular tests would be most relevant, to research those tests, and then when the test results came back, to help the physicians understand what the implications of those results were, whether there were targeted therapies available, if there were clinical trials available, and what was the evidence in that specific disease for that specific mutation. At the end of every report, there's a patient, and there's a patient with cancer. So we know that the work that we're doing is helping a lot of individual patients to find the therapy that may be the most appropriate and may be the most helpful to them to help extend their lives. In January of this year, N of 1 was acquired by QIAGEN, and we are very excited to join the QIAGEN family. QIAGEN has a great bioinformatics process that leads really right up to where N of 1 picks up. QIAGEN's bioinformatics does a great job of identifying variants and classifying them, and our reporting then takes that to the next step and applies lots of specific evidence and report writing, so that for companies or physicians that don't want to do the report writing themselves, we present them with all the information that they can just sign out. N of 1 has also worked with pharmaceutical companies to help with drug design and drug development, really across the drug development life cycle. So we bring to QIAGEN a large database of what we would call real-world data. N of 1 database is basically a large source of real-world data, and we've aggregated this large amount of information. It really represents the larger world of cancer patients and not specific sets of patients that have been identified for clinical trials. So the ability to use this real-world evidence that's in many ways less biased than some other sources, but is also curated is a very significant advantage.
QIAGEN.
Sample to insight.